Alright, so the ER doctor yesterday told me to do my own research. And upon doing my own research about my foot, I think it's pretty safe to say it's not plantar fasciitis, because with plantar fasciitis, you have pain in your heel. I don't. I have it right here. And I have it all over the left side of my ankle. Well, about 8 months ago or so, when I got out of my truck, maybe a year ago, there was kind of a groove. So it could be anywhere from 8 months to a year and a half ago. There was a dip. And my heel hit in it and I twisted. Never really did anything about it. And off and on, my left outer ankle has been hurting really bad. Well, yesterday, this hurt. And it's still sticking out, which is, I don't know the name of it. It's a really long word. Hard, I can't even pronounce it. So I shouldn't have it. Just like food you can't pronounce, don't eat. So what Google is saying is that it could very possibly be a stress fracture. Now, that could be on the outside of my left ankle and can have been there since that day. And with my 3 so far spinal conditions, and my outside my ankle hurting occasionally, I've changed my walking pattern because I'm always afraid if I step wrong, my left ankle is going to break. And I've told my husband this a million times, literally not exaggerating. So it could very possibly be that from shifting my body weight to take pressure off my ankle, that I have pulled whatever this tendon is called right here in the bottom of my foot, which is protruding. So you can see it. That right there. That's where the pain was. Now with plantar fasciitis, they say it will start here in your heel. I have no heel pain. I had a little bit here. I have some here. I have it going down here. I have some here. I had it in the back of my Achilles, but most of it is centered here. So I get a lot of top pain and outer ankle pain. That is not indicative of plantar fasciitis. So I'm going to give it till Monday, and then I will call my doctor and set an appointment to have a full, evaluation done on my ankle to see what it possibly could be, because I never really did anything with it. But I get a lot of outer left ankle pain, and I do step differently when I go to walk. So I'm pretty sure I pulled something. And like I told the doctor, I'm afraid, or I was worried that I have a fracture. The ER doctor x-rayed the outer part of my foot. I'm not sure if he did my ankle. But before he even did any of this, the first thing he did when he walked in the room was said, I think it's plantar fasciitis. Okay. But I never told you I had heel pain. I know what plantar fasciitis is, for the most part. And upon research, that's not where it's pointing. So, my conclusion is I have an ongoing sprain from that incident, which never healed. And then, because of my walking, I pulled something on the bottom by stepping wrong when I got out of the truck yesterday, which is very possible because I don't remember doing anything. But talking to my husband this morning, yesterday when we were going to the truck, my little dog, Chevy, stepped on the back of my shoe 3 times, so that could have pulled it. I have been feeling like since the day of the incident when I stepped out of the truck and my heel went into the thing, and I've been feeling like I've had a break in my foot. So, it could have very well have been a stress fracture, which is very hard to see on an x-ray. But if the doctor knows what he's looking for, an ortho doctor, he'll be able to see it. So what I need to do is get a hold of my doctor, have him do a set of x-rays, look at it, if he can't see it, ask him to forward it to an ortho with the note attached. Look at the ankle area and see if there was a prior stress fracture to the outer ankle bone from maybe 8 months to a year and a half ago. It also could be arthritis. I'm 52. I went through menopause, 3 years ago maybe. No hormone therapy. And I have osteoarthritis at the lower spine. I'm sure I have it in my knees because I have arthritis in my knees. I'm sure it's in my arms, my shoulders, my neck. Maybe it's in my foot. So there's quite a few options, but I'm willing to bet anything that the doctor had a one-track mind and wasn't willing to look at any other option. And he most certainly didn't listen to the symptoms. I know my body, and I'm pretty good at this. You know, if we're not diligent in our care and we just take the first thing that's thrown at us, that could be very dangerous. We can live with unnecessary pain. We can get the wrong diagnosis. They can give us medications we don't need. The last thing I want to do is put more steroids in my body. I had pneumonia a couple of years ago, and I don't need to do all that. I've had so many medications in me since my fall just over 2 years ago that I don't need to keep doing that. I don't. So I'm going to keep doing my research. Go to the medical WebMD, put in my symptoms, and come to the best possible conclusion. Relay it to my doctor. And hopefully he'll listen better. Because this has been going on for some time. The pain was only yesterday for a few hours. 4 at the max, 2.5, maybe 3, 3.5, 4. On the bottom of my foot. Right here. Now it's a little tender, but there's none here. It's not predominantly here. It's predominantly here. I have some tenderness here. That doesn't scream plantar fasciitis. That screams an old sprain that has been resprained or continues to oversprain when I move. Dogs step on my shoes. Or a stress fracture that halfway healed that they're just not seeing because they're not actually looking in the ankle area. Which, yes, upon research, it can send pain from here and shoot it down into that thing. But this is most likely because I'm compensating for this hurting and afraid it's going to break when I walk and pulling this. And that could have simply happened by stepping out of the truck and not even knowing, just slightly turning wrong, and they're just hyperextended, which is very painful. But for that pain to be gone that fast tells me that it's actually radiating from my ankle. It would still be there if I actually pulled something. But when I do flex my big toe, that ligament, I think it's a ligament, not a tendon, but I think that's why it's protruding. So it is definitely something to keep an eye on. But I have no heel pain. It's very minimal in that part of the foot. Occasionally when I step, it will hurt really bad, but it's not constant. And we'll see.